So I'm Brett McIntyre with Polk County Emergency Management Training and Exercise lead here. This is our Lunch and Learn program. We've got Carrie Levitt of Townsend here, Polk County Communicable Disease Team. We're going to talk about some of the resources. I know you said you did this a couple of weeks ago with Clive and hit a lot of our EMS providers and workers out there. So I think you said 92 got in the room and online. So we're going to try and clean that up today, and we'll post this online as well, so you can refer back to it if you have any more questions or it needs to be shared around. Use it at an upcoming meeting. But I'll go ahead and turn it over here to Carrie and let you get started.
All right. Well, thank you. As Brett said, I'm Carrie Levitt of Townsend, Disease Prevention Supervisor with the Polk County Health Department. I've been in this role, I've been with the Health Department over 14 years, and I've been in this role over 11.
Hi, I'm Janelle Turner. I'm one of the nurses on the Communicable Disease team, and I've been here just about 2 years.
I'm Kate Taylor. I am been part of the team for 7 or 8 years now. Do various different things with also helping. I'm also a nurse.
So wanted to start talking a little bit more broadly about some of the services that are offered through the Polk County Health Department. This is not an exhaustive list, but some things that I think it's important for people to know, and you may have opportunity to refer individuals for services. We have a childhood immunization clinic that offers vaccine for children. And so families that have kiddos that aren't insured, this is a great way for them to come and get their vaccinations. Also, the staff work really well with families to help them establish a medical home for their children. We have a sexually transmitted infection clinic that I think is one of the most unique in the state of Iowa, and in that it is a completely confidential clinic. We do not take insurance information so that people have the opportunity to ensure confidentiality, that there won't be an explanation of benefits coming home if that would be a concern for them. The clinic, I have some information here on different things. We have a sheet on the clinic. It is $10 for a Polk County resident to attend, and $25 for a non-county resident to come in for an appointment. That does include testing and medication they may provide in the course of that appointment. And we do have the ability to hardship those costs if someone just does not have a way to pay. So we want to make sure that people are tested and treated. We also have a travel clinic that can help provide information about the destination where you're going. We have a travel program that helps with health alerts for different destinations and countries, and then also get vaccines that are needed for travel to various countries. A great service offered here at the health department. We have a lead program that encompasses 2 different aspects. One, we follow up on children that have elevated lead levels and are lead poisoned. In addition, we have a HUD program that takes care of lead remediation. So looking at homes 1978 and before, they inspect to see if there's lead hazards, and then what's the best way to remediate that. It might be painting windowsills, it may be replacing windows, might be replacing siding. The amazing before and after. I don't think I have any before and after pictures. Maybe there are some here. There's a lead hazard brochure here on the repair program. But they can work with people who own their own homes, who rent. There just needs to be a child under the age of 6 that's there, lives there, or spends a lot of time there, like maybe goes to grandma and grandpa's after school. And that lead in the home would pose a risk to those young kids. So it's a great program. There are phone numbers on all of the information here or you can look on our website to get information to call and learn more about the programs. We have a new campaign called Talk It Up, Lock It Up, where we're making gun safety locks accessible at no cost to people so they can lock up their guns. And there's information and education as well that goes along with that campaign. We have gun locks here, different libraries. Again, more information on the Polk County Health Department website about where you can access this information. I have a picture here about the harm reduction kits that are available in various locations. Most notably, right out front of this building, we have a sharps container where needles can be returned. And also we have a box that people can get a code to get a harm reduction kit. And the intention there is we know some people are going to continue to use needles, and to make that safer so that they're not spreading diseases like hepatitis and HIV if they're sharing needles or reusing needles. And again, more information on the website, and we have a handout here also on how to access that program. In just a little bit, I'll talk more about our breast, cervical, colorectal, and heart health services. And the main reason that we're here today is to talk about the work of our communicable disease team. And I have to mention the public health investigators that investigate the 4 reportable STIs, which are HIV, syphilis, gonorrhea, and chlamydia. So the communicable disease team does all reportable diseases with the exception of those 4 STIs. So talking about breast, cervical, and colorectal and heart health screening. One of our programs here is newly named Ribbons of Hope, formerly known as the Healthy Women Program. Wanting to have a little bit more of an inclusive name as we expand services and provide colorectal cancer screening, and also just, as I said, be more inclusive. This program is for those who are uninsured or underinsured. It is for lower income, but it's 250% of the federal income guidelines, and that is net, not gross. So there's a lot of opportunity for people who are lower income to be served. We offer cervical cancer screening, breast cancer screening, the colorectal cancer screening, and now some new cardiovascular screenings through some local funding through the county and the generosity of the county that was previously and no longer provided through the CDC. So we can cover the office visit, those screening tests, and then if there are abnormal results, the program can cover limited diagnostic tests, and there's patient navigation, nurse case management, a whole lot of services and support and education that come along with being enrolled in this program. And there's a phone number right there to call for more information or to refer someone if they're interested in services or don't have insurance. Okay, I'll turn this one over to you.
So this is our core communicable disease team. So it's Janelle, then we also have Caitlin, myself, Carrie, Melinda, and Ambika. And basically, we are the primary disease team. We do have access to extra help if we need it in outbreaks or pandemics or emergencies, that type of thing. Basically, we again are the core team that does a lot of the following.
We work very closely with the state as well, in partnership with the state, as well as providers, hospitals, infection preventionists. The other thing that I want to point out is the phone number, the 286-3890 number. That is a resource for you all to call if you're concerned about that maybe you're working with someone who has an infectious disease, or you want more information about maybe something that's currently going on. infectious disease wise, that may affect you directly or affect the work that you're doing. So this is a great number to reach one of the members of the team to get some information and get your questions answered.
There are also business cards up here with that phone number on it, so feel free to pass around. Okay. Okay, so the primary things that we do, are the tuberculosis control program, and we follow active and latent TB. We do sputum testing, to rule out active cases. And we'll go a little more into that here in just a minute. We do reportable infectious and vector-borne disease investigations and contact investigations. Those are usually sent to us from the state. We do tick-bornes, we do E. coli, salmonellas, legionellas. Summertime campies and cryptosporidosis pops up quite frequently that we end up following. So that is always fun. Foodborne complaints and interviews. We usually will take an interview and follow up as needed. And then if it comes down to an actual outbreak investigation, we will actually trace where, what caused the outbreak, contact all the people that have been exposed to get their information, possibly request stool kits, and we work closely with the state on those when those happen. And the same with the infectious disease clusters and outbreak investigations. We're kind of always on standby for measles and things like that. We'll actually, if we get somebody that's been exposed to Ebola in town, we'll follow up with that. And then green card immunization clinic, basically, we will follow up with vaccinations for anyone that is needing their green card adjusted. And we do those 4 afternoons a week now. That's about it.
A couple other things I'll just mention is that we also, on the foodborne diseases, we work closely with the state hygienic lab and DIA, which now also has licensing, so it's Dial. We also work closely with them on the investigations as well. And also anything disease, foodborne, can become bigger than Polk County. We can be working jointly with other counties across the state, with other states, with the CDC. Often we have outbreaks that affect multiple jurisdictions and we're all working together.
Okay, so this list is of reportable diseases in Iowa. I'm not going to read through each of them, but as you can see, it's quite extensive. There are some that are required to be reported immediately: anthrax, botulism, cholera, diphtheria, measles, meningococcal invasive disease, plague, poliomyelitis, rabies, and SARS, as well as viral hemorrhagic fever and yellow fever. Obviously, there's a big variety. So we see a big variety of cases come in that need to be followed up. And we work with the state in investigating and asking questions and finding out more about the exposure, how long they've had it. Just a real deep dive into how they came to get this disease and what treatment, if any, they're receiving.
I'll also mention Iowa is a dual reporting state, which means by Iowa code that laboratories and providers are required to report any of these diseases as they encounter them. Especially the immediately reportable diseases, we encourage providers to let us know if they suspect that that's something that they're looking at and doing further testing. So that we can work together, we can help to facilitate tests often more quickly through the state hygienic lab. And that also helps us to begin the work that we need to do in terms of identifying who may have been exposed, making sure that we're minimizing exposure to other individuals. So the sooner that we're notified, the more responsive we can be more quickly. I would say majority of the time labs report to us, but providers will call and say, hey, I think I'm dealing with a case of hepatitis A here or Neisseria meningitidis. And then we can start to work right away. And it may not come to pass that it is that illness, but it gave us an opportunity to get involved very quickly and reduce exposure or potential exposures. So with all the diseases that you just saw on the previous slide, as we investigate and as we do contact investigations, there may be situations in which we need to isolate, quarantine, or exclude someone. And we like to work with folks so that they will voluntarily agree to confine themselves to home and avoid exposing other people. But we have options beyond that. But we really find that most people really want to do the right thing and ensure they're not making someone else ill. And but there are times we do put people under orders. Even if they're cooperating, we just provide them with that. It also affords them some protections if they need to be off work. Exclusions are often around those illnesses that cause vomiting and diarrhea in work that we would not want them working while they're ill. Healthcare, food service, childcare, and that type of thing. The diseases that you saw on the previous slide, as Janelle mentioned, many are immediately reportable, but some are less severe and it can be up to 7 days, although we'd love to have them reported more quickly. There are other things that we follow up on that aren't on that reportable disease list. Anything unusual that occurs is something that we in the state ask to be notified of. A number of years ago, we were seeing a lot of young people in the ER in respiratory distress. And as it came to pass, it was from vaping some particular chemicals. And so we're involved very early on doing some interviews, taking some information and being a part of the CDC identifying what was the culprit in those cases so that we could reduce that continuing to happen in our young people. We also respond, we engage in preparedness efforts so that we can respond in health emergencies, public health threats, pandemics such as COVID-19, bioterrorism, if it were to occur. And we work closely with EMA when we have emergencies or public health threats, and also in other cases where there's a health component to a response. And then we also do surveillance and consultation. We do absence surveillance among schools, which is an important barometer of the health and well-being of our community when we look at how many students are out on a given school day and what that trending looks like for absences can help us to have a better understanding of the health and well-being of our community. We work with long-term care facilities where they may have an outbreak. Childcare, for example, chickenpox is not a reportable disease, but if there's an outbreak of chickenpox in a classroom or a center, then we would be involved in supporting that childcare center. We also do surveillance with regard to mosquitoes and ticks. and other things, to address the vector-borne illnesses that we see.
The 10 most frequently reportable diseases that we deal with in Polk County, is Campy, Salmonella, E. coli, Lyme, Shigella, Legionellosis, Cyclospora, malaria, Cryptosporidosis, and Giardias.
And this is for the last 2 years, and this changes over time. And it changes some with seasons in terms of, we'll start to see more Salmonella, E. coli, Shigella, those things that come with, eating food that maybe wasn't stored safely or properly, or going on a picnic in hot weather. So we're gonna see more of that foodborne illness occur more in warm weather times. Some things like malaria come from people traveling and coming back with that illness. So times where we see more vacations and travel, that's a time where we see more. So it's a bit of a moving target, but there's a lot of the same suspects very often. And then occasionally we'll have an outbreak of maybe pertussis or another illness that will make the top 10 list in a given year or a given period of time. So thought we would talk a little bit about things that are current public health issues that we're addressing now. You've probably heard a fair amount about measles in the news. As of the 23rd of this month, there have been 142 cases, confirmed cases of measles in the United States in 21 states. Of those 142 cases, there were 10 outbreaks. One recently in Chicago, as a matter of fact. When we look at the cases of measles, the majority are unvaccinated. So typically they're unvaccinated and they've either traveled to a country where measles is endemic and they were exposed, or they're here unvaccinated and exposed to someone who has measles. So about 95% of the cases so far this year have either been unvaccinated or they've been not fully vaccinated. They've only had one MMR, and that might be because they're simply too young to be vaccinated yet. So one of the things that we really encourage people to know the signs and symptoms, the fever, the cough, the runny nose, the conjunctivitis, know those signs and symptoms, then rash following those signs and symptoms. Be aware of that, recognize it, ask if you're in healthcare, be asked about travel. Have they traveled somewhere where they may have been exposed to measles? And then personally know if you have presumptive immunity to measles. That would mean you've had 2 MMR vaccinations. You are old enough that you had measles as a child or a young person, or you've had a titer drawn that tells you that you have immunity to measles. And we in public health appreciate it if you have documentation of your presumptive immunity at hand. Because if you are exposed to measles, as we contact you, that's one of the first things we're going to be looking for. Because those who do not have adequate presumptive immunity will be quarantined for 21 days or 21 days after their last possible exposure to prevent exposing someone else to measles, should they break down with it. Also in the news has been the high path avian influenza. This is a disease carried by wild birds that does not make them ill, but when our domestic birds are exposed to their droppings, they can become quite ill. We've also just this year had some dairy cows test positive for this virus as well. The risk to people is low in that there's no known human to human transmission to date. Right now, we've had a few cases in the US of either bird to person or cow to person transmission of the virus. So in public health, what we do is if someone is on a farm where there's an outbreak or at a facility where there's an outbreak or where there have been responders to an outbreak, we monitor those individuals. And if they become ill with respiratory illness or signs of flu, then we will test them to determine if it is high path avian influenza. And monkeypox, or now what the CDC is calling Mpox. We've seen this in the last few years. There's vaccine available. A couple of years ago, we did quite a bit of vaccination for this virus. Currently, there's an outbreak in the Democratic Republic of the Congo. And so when there's an outbreak anywhere, that's a concern to us here. We're keeping an eye on it. Again, that's where travel history for someone is important if they have signs and symptoms. So this is also something that another disease we follow up in public health. And then as the weather is getting beautiful, there's a lot of health concerns in the summer that we're aware of. As I mentioned, vector-borne or mosquito-borne or tick-borne diseases, like West Nile virus from mosquitoes, or Lyme disease from ticks. These are all diseases we follow, but we can prevent by preventing mosquito bites. We can prevent by, preventing ticks from biting us and taking a blood meal. Also, heat-related illnesses are significant and cause really more illness and death than a lot of other natural disasters combined. It's hard to imagine, but it is in fact the case. Heat stroke and dehydration, very serious and can be life-threatening. So we're definitely wanting to promote awareness of that and ways to prevent heat-related illness. And then while people are having fun in the sun and swimming, there are things that can happen in terms of injuries and accidents, drowning, improper diving or diving in shallow waters can cause accidents, but also a lot of waterborne illnesses. So ingesting water from a lake or a pool, we can see things like cryptosporidium. And so we do a lot with trying to make people more aware and take steps to prevent this type of illness.
Okay, also in the summertime, we see an increase in foodborne illness. 1 in 6 Americans get sick with a foodborne illness each year, and Iowa has the hotline to report foodborne illness, the 844 Iowa Sick, and we do take those calls here in the Communicable Disease Office. Oftentimes it's somebody that ate at a restaurant and they started feeling ill the next day or later that same day, depending on what illness they may have. And so we follow up on that. We send that to the state, and then the Department of Inspection and Appeals looks into that particular restaurant. And sometimes we'll find out about a foodborne outbreak through one person calling saying, hey, we ate at this restaurant. I was there with 7 or 8 other people, and of those people, 5 or 6 of them are sick. So then we start investigating the additional folks present at that meal and just to help us get a better idea and gives DIA a little bit better idea of what's going on when they go in to do that inspection.
And this number is viable all across the state. So anybody from any county can call this line and get connected with public health locally for them.
And then regarding foodborne outbreaks, like I said, we established the existence of an outbreak. We interview all people involved. We do a lot of education, especially around hand washing. Hand hygiene is one of the most important things in preventing the spread of illness, especially those that are fecal oral route. And then we refer ill people, sometimes they need to see a doctor if they're really dehydrated, can't keep anything down. We conduct testing, often of stool samples, and then we try to identify the source, see what commonality might be, and in some occasions, actually testing some of the suspected food. We implement prevention and control measures, and then we communicate findings. If it's an outbreak, it'll be a large conference call with DIA and different folks from the state involved as well. And so there are a lot of moving parts, especially once it gets to an outbreak level.
And it may result in a recall.
Yes, so that's important information to get from individuals, especially if there is a recall out there and perhaps they've had it, or if a recall is set.
And we may not always determine the source, but it can actually go all the way back to the grower. Or maybe it's something that happened in distribution. So trying to identify that source so that there can be corrective action. Switching gears, we want to talk about tuberculosis. Across the world, TB is one of the most deadliest diseases that we have, infectious diseases that we have. Not so much in the United States because of our good public health control measures and efforts. But it's something certainly continues to be of concern. We often talk to people who think that TB has been eradicated. Unfortunately, that is not the case.
So technically, there's a couple different types of TB that we follow. One is just an infection. It's the latent TB infection. Basically, you have the bacteria in your body, but it's dormant. They have no symptoms. They're not sick. They are not contagious. And this is a huge bit of information because a lot of people will say, oh, I'm being treated for TB. 9 times out of 10, they're being treated for latent TB, which means they're not contagious. But people tend to think TB and automatic contagion. So that is a big point there. They usually have a blood or a skin test that will show if it comes back positive, that means they've been infected. Their chest x-ray is normal. They have no smears. All their smears or cultures are negative from their sputums, and treatment will prevent it from becoming active. So we follow a lot of TB latent through our office, which I'll go into a little bit here. A person with active TB usually has symptoms. They usually feel really sick. Are you going to go over symptoms? Going over symptoms or not? They are contagious. They are only contagious in a certain time frame. They are in quarantine when we first suspect that they have the symptoms. Cough for 3 weeks, fevers, really don't feel well at all. If the sputums come back positive, then they are considered active TB. They will be started on a treatment regimen. They will have to stay in quarantine for a certain amount of time based on factors as to where their TB is, the treatment that they're started on, that type of thing. It's usually the doctor will figure out, this is what we're gonna do, and follow them. Their chest X-ray normally is, their chest X-ray is abnormal. And they may have positive sputums or cultures, and they definitely will need a treatment that is a lot longer than LTBI. LTBI treatment usually will run about anywhere from 4 to 9 months, depending on what prescription the doctor decides to give them. LTB or active TB medication can run up to 2 years, depending on what you run into, type. So when we're following latent TB infection, we do a lot of education, with patients. We follow their treatment. They actually come here once a month to pick up medications. We monitor them when they come in. We ask them how they're doing, if they're having any side effects, any questions, we will answer. Usually, most of the time it's due to side effects. We do support for the treatment completion. We check in with them at the end of their treatment when they pick up their last bottle. We will actually give them a letter that says, this is your last bottle. When you finish this bottle, we need this information back. So we know that they have actually completed every pill that they need to complete. And then we do a lot of coordination with the providers and the patient. What else do we do coordination?
If they have side effects, you know, we'll coordinate with the provider to determine, do they need, what do they need to do? Do they need to rest from treatment for a little bit, or do they need to maybe add like a B6 vitamin to the course of their treatment? So adjustments are made based on what the individual needs.
And then the active TB, we do probably a lot more hands-on, definitely with the active than we do with the latent. The active TB cases at that point are contagious. We get them from the beginning. We do lots of education with patients about the medications, what to expect over the course of the treatment. We also, when we first have an active TB case, we will do case investigations, which means we will get every person that's been in contact with them. And then we will follow up with testing for those people. Making sure that do they need treatment? Do we need to follow up to make sure they're not active? They will go into isolation if they are a pulmonary TB or what's the other one?
TB of the throat.
TB of the throat. That is the pulmonaries in the lungs, which means it will, you blowing it out, you're contagious with breathing. So the contact tracing and testing also goes back to the investigations, where we sometimes will have 10 or 15 people that are contacts to an active case that we will need to bring in and do blood work on. And then if they're negative, then we know that they're not activated.
They didn't become infected with
Right.
TB.
Thank you. Sorry, I will be on my mouth today. It's nurse case management. The nurses that follow the active cases will actually start by going to their house every day, except on weekends, and going over all the information. They will go to their house daily to provide the medications, because with active TB patients, we want to watch them take their medicine. We want to make sure that they're taking their medicine. Again, the treatment can last anywhere from 9 months to 2 years. They start on a 4-pill regimen that drops down after a certain time frame. It also depends on if they're multi-drug resistant versus active or just normal TB. We also do direct and video observed therapy now. The direct observational therapy is when we do actually go to their house and we watch them take their pills. We have recently added video observation therapy, and that is the nurse, when they're setting the patient up, will go to their house. There's a program that goes on their phone that actually will video them taking their medicine. And then when they're done, it gets sent to a program that we can then access here. We can go back in and watch them take their medicine via the video. There's some advantages to that, in that sometimes people don't want to take their pills between 8 and 5 Monday through Friday. They want to take them at 9 o'clock at night, when we're not available to watch them do it. So if they do the video, then we can come in and watch the next day and make sure that they've taken them on that.
It's really a neat program. We can communicate back and forth through it as well. We can send reminders and messages. So it's really a neat resource and has some capabilities to be used in other ways, in public health emergencies as well.
The other thing that we can do is, if they're put in isolation due to being positive, that usually becomes a big issue, because sometimes they can be in isolation for 3 months longer. We can actually help them with financials, rent, food vouchers, things like that, to make sure that they are viable. Their families have access to utilities and things like that, so.
Yeah, so some of the signs and symptoms of active TB include coughing for 3 weeks or more, sometimes coughing up blood, chest pain or pain breathing or coughing. Oftentimes there's loss of appetite, fever, chills. Also, we see a lot of unintentional weight loss. People are very thin and have a lot of fatigue. And TB of the kidneys may cause blood in the urine. TB of the membranes around the brain, also known as TB meningitis, may cause headaches or confusion. So knowing the signs and symptoms are very important in making sure that we get the right treatment for that individual. One of the things that we kind of touched on is TB of the lungs is called pulmonary TB, and other parts of the body or organs is called extrapulmonary. So even though we see a lot of pulmonary patients, we do, excuse me, run across extrapulmonary patients from time to time. So it seems as if those cases are a little more complicated when it's outside of the lungs.
So TB can basically grow and cause disease anywhere in your body, any organ, any place in your body. We've had a couple of patients recently that the providers thought that they had Crohn's disease, and when they weren't responding to treatment and looked further, they actually had TB. So, yeah, wherever the TB is in your body and it lands and then decides to grow at some point, that's where you'll have, whether it's, you can also have pulmonary and extrapulmonary as well. But it's only the patients with pulmonary TB or TB of the throat that can have disease that is contagious and can spread it to other people for a period of time until they've been treated.
So this slide just kind of goes over the different areas, the central nervous system, lymphatics, pleura, disseminated is miliary tuberculosis. It can also affect joints and bones, as well as we mentioned the genital urinary tuberculosis. One thing to keep in mind is that TB, if they have other diseases such as diabetes, like HIV, that can make things more complicated as far as the duration of treatment and how well they respond to treatment. So having a good idea of other things that may be going on with the patient is helpful in this situation.
And in fact, might play a role in the development of active TB, anything that is a drain on the immune system can hasten active TB in the body, so can bring it about. One of the things wanted to share, that in Polk County, we have a great system that respects HIPAA, but also helps to protect our responders. So if we have someone who is in isolation or quarantine, we have the ability to flag a note in the address recommending PPE for responders should they respond to that address. Doesn't say who might be ill, it doesn't say what the illness is, but it does recommend PPE for them for protection. So it's only triggered if there's a call to that address. And then when the individual is no longer in isolation or quarantine, that flag comes off and goes away. So it's a great way for us to protect our responders.
And then just in closing, our phone number is listed again here. Always happy to answer any questions that you may have or any concerns that you may have. Just give us a call at the 286-3890 and one of us nurses will answer, and we're more than happy to answer any question that you have. If we don't know the answer, we'll research and find out and give you a call back, but we're happy to help and work with you in any way that we can. Given that, anybody have questions?
EMS responses occasionally, and it's a rarity, but we'll have a patient who says they have TB. Are you the go-to person to contact, should that be the case?
Great place to contact. Certainly, I know there are some mechanisms to work with hospital and infection prevention, but we're also an option. And we will then work with infection prevention as well. If there is a concern that a patient, if they're saying I have TB, and the question is does that mean they have active TB?
Yeah, and actually the reason I bring it up and why this class had my interest was recently, to use that term loosely, we had somebody that said they had active TB. It turned out they had latent TB. So we started sending people to get tested, and then we found out it was latent. So we kind of pulled the reins back, but obviously we can only go off the patient information that we get on a call and try to react to it best we can, but.
Yeah, and in that case, I think a very good course of action is to contact us and let us verify.
Okay.
And then we, if there was a potential for an exposure, then we're involved in taking a look at that, determining if somebody's potentially been exposed and what testing should occur. And certainly, each unit or department has their mechanisms to work through, but we coordinate in those cases as well. So we recommend you follow your protocol, but certainly we are a resource to determine, is this a concern? Is this a health concern or not a health concern? We're also, you know, an option too, and this happens. I don't know, I can't say with what frequency, but it happens. You might, be transporting, folks and you might be seeing a number of people, you know, maybe from the same area or the same facility with the same symptoms. That 3890 would be an appropriate number to give a call, certainly touch base with your chief. But it'd be appropriate to give us a call and say, hey, we're noticing this. You know, might help us to identify a potential outbreak. So we can look into it a little bit more and respond accordingly. And we may already know if there is something going on, but you know, it might just be at the very, very cusp of an outbreak, and that could be helpful to us as well. So, and really to responders and the facility, because we can offer support
Sure.
all around.
You notify dispatch when you know that there's something like that in an area, so that if we get a call, just heads up, there's such and such in that area,
We
or
work with EMA on, you know, situations, so there's awareness if there's a need for PPE.
who's not aware that TB affects other areas. I always thought it was a lung thing, but that one slide you had it kind of reside in various parts of the body. So
Yeah, just wherever that bacteria decides to wake up on someone. Seen young children with TB in their hip joint. You know, seen people with TB in the skin or the brain or the spine, I mean, just anywhere. And of course, the symptoms are very different depending on what part of their body is affected. The advantage to it being extrapulmonary is that they're not contagious to other people, which is a definite public health benefit. But certainly can be a real significant health concern for the individual,
sure.
which is why we want to get them treated when they have latent TB, so we can prevent them from progressing to active disease.
Thank you very much for doing this.
Yep, thank you.
Thanks for coming.
Yeah.
And any questions that come up later, you have the 390 number. Feel free to give us a call.
Thank you.
And if we have some resources here and some pens, if you'd like to, if anything.